Hi, I'm Dr. Colin Elkin, and this week I want to share with you a really cool story. I was very privileged to see a 4-month-old baby come into the office. And a lot of people scratch their head and wonder, why would a 4-month-old baby come in to see a chiropractor? Well, a really interesting story is that this baby was born with a condition called torticollis, where the nerves in his neck were damaged as he was developing in utero. And when he was born, those nerves were so damaged they caused the muscles on one side of his neck to spasm. So he was born with a condition where literally his ear was touching his shoulder. The muscles were in such spasm. So ever since he was born, the poor little guy, his neck was like this, in a position like this. So now that he's 4 months old, the condition still isn't coming along. Now she's taken him to see physiotherapists. He's seen a massage therapist, and it was actually the massage therapist who recommended to the mom, you should go take him to see a chiropractor. I thought that was really awesome. Mom, like anybody else, in most cases would question, well, why? I don't understand. But here's the thing, is that chiropractic really works on the nerves. We're all about the nerves. It's all about getting the nervous system functioning better. Now, in a condition like torticollis, the spine has actually shifted place. There's a condition we call subluxation, where the spine shifts place. Those bones shift out of alignment, shift out of place. They lose their normal motion and position, especially in the cervical spine, up in the neck. They press on those nerves. Those muscles go into spasm as a result. It's actually a protective mechanism for the body. And hence the baby's born with a condition called torticollis, where his head's over on his shoulder like this. So chiropractic is a great way to directly affect how the nervous system is functioning. So what we've done is we've started a course of care to start moving the bones in his neck very gently, very specifically back into their normal alignment. And if you've ever seen a baby get adjusted, it's really a unique thing to see. It's very gentle. We use fingertip pressure. It's just moving and massaging those bones very specifically. Sometimes we can feel movement of the spine. And what happens is, as the spine starts to move, pressure's taken off those nerve roots, the nerves flow better, the muscles start to relax. It's really a neat thing to see. We've had such great success with that. So I feel really privileged as a chiropractor to see families, to see young children, especially infants. Over the years, there's been many stereotypes about chiropractors. In fact, most people kind of have if they know anything about chiropractic, they kind of have the mentality that you only go to see the chiropractor when you're in pain. And in most cases, it's back pain or neck pain or headaches. They're the three biggest things that most people go to the chiropractor for. And it's kind of interesting because chiropractic gets great success with seeing people with those types of conditions. I mean, over the years, since chiropractic was founded in 1895, people with low back pain and headaches and neck pain have gotten great response from chiropractic care. But it's only because chiropractors focus on the spine, get the nerves functioning better, and when the nerves function better, the body can heal and repair itself at a much better level. And that's why those conditions really start to respond. But really, when you look at it, is that the nerves, the central nervous system, the brain controls everything in the body. It sends messages through the spine. Those nerves go out to all the different organs, all the different parts of the body. So many health concerns that people have are related to the function of the nervous system. So once we start managing the spine, correcting those subluxations, getting the body functioning and getting the nervous system functioning at a higher level, we see tremendous success, and people start to heal from things that they never knew that they could heal from. Chronic disease, chronic problems. We see so many children for that exact reason. So many childhood conditions are affected by the function or dysfunction of the nervous system. When children are born with spinal dysfunction or subluxation problems, that can affect how those nerves function, it can affect how those nerves work, and it can lead to a lot of childhood conditions. We've seen infants, babies, youngsters with colic. We've seen children with ear infections. We've seen children with asthma, bedwetting problems, trouble sleeping, ADD, ADHD, autistic children. All of those conditions have been affected by dysfunction of the nervous system. So as chiropractors, when we can analyze the spine, when we can detect those subluxation patterns in the spine and get that child on a course of care to get those subluxations corrected, ultimately that nervous system starts working better, and guess what? The person starts to heal. That child starts to function better. A lot of those conditions become history as a result of that. We've seen many kids get off medications. We've seen children start to reach their true potential in life when they start getting their spine adjusted on a regular basis. We're so privileged in our office because we have the opportunity to see so many children. And children do great with their chiropractic care. They come in, they hop on the table, they get adjusted. The adjustments are comfortable, they're gentle. It's really great to see how children respond and how many of those childhood diseases and childhood conditions respond without medication, and that child can really truly reach their full potential in life. I really encourage you that if you've never taken your child to a chiropractor, please take the step. Bring them in to see us. We'd be happy to do an exam on them, check their spine. We look for conditions in the spine where the spine is not moving properly, where it's slightly out of position. It may have been from a birth process, a traumatic birth. It may have been from a childhood fall or injury. And you know, as children are developing, learning how to walk, learning how to crawl, they have injuries and falls every day that can seriously throw the spine out of alignment. And if it's never corrected, that can go on through their lifetime and lead to all kinds of childhood and adult problems. One of the things we look for when we examine children is spinal curvatures. So we look for something where if the spine is curved in the wrong direction, from the front, ideally the spine should be straight up and down. But sometimes people will have a curve where their spine does an S type of shape. And we call it a specific condition called scoliosis. And many times scoliosis can be left completely undetected if it's never really looked for. Many health professionals really don't have the training to look and screen for scoliosis. Well, that's something that chiropractors specialize in. So we've seen so many children where parents had no idea that their child was developing a curve in their spine. And we have very specific techniques to try to manage that scoliosis and challenge that spine to go back into its proper alignment and proper direction. Well, the great side effect of that over time is that the child starts to function better. We stop that scoliosis from progressing. We can really change the person's posture. Aesthetically, the child looks much more level, more even. They're taller as a result because we've changed the curves in their spine. But from a functional standpoint, that nervous system starts working better, and a lot of childhood conditions or conditions that are developing, diseases that are developing in the body, can actually be stopped and reversed as a result of getting those nerves functioning better. We really encourage you to get your child checked for scoliosis. That is such an important part of their development. It's just like regular dental checkups. It's like regular medical checkups. In fact, even more important because so many times that scoliosis can go left undetected if it's never really looked for. Now we know, as science has shown, that regular medication given to children can cause all kinds of side effects. In fact, it's actually been scientifically shown that antibiotics given to kids in their first year of life can really predispose them to asthmatic conditions later in life. So we like to try to do everything we can to help parents avoid giving their children medication, only in absolute necessary situations. So by getting their spine adjusted, keeping their nervous system functioning better, it's actually been scientifically proven that that does boost the immune system and really helps children prevent getting a lot of colds. And when they do get colds or flus or any type of disease and sickness, they tend to respond and get better that much faster because their immune system is working so much better. I'm Dr. Colin Elkin at Elkin Natural Health Center in Brantford, Ontario, 160 Brant Ave. If you've never taken your child to a chiropractor, we really encourage you to bring them in, get them checked. We can do a screening for scoliosis. We'll check their spine, check their neurology, their nervous system, see how it's functioning, and really make sure they're on the right path to health and wellness.